Finding a doctor in Western New York is getting tougher. The number of primary care physicians has plummeted nearly 25% between 2010 and 2013. Why is this happening, and can it be fixed? News 4 Dr. Peter Ostro is here to break it down for us tonight. Dr. Ostro?
We can have more primary care physicians if we train more of them, and fixing that problem will take federal money. That was the message Senator Charles Schumer delivered today. If you've had to wait to see your doctor, the statistics will not surprise you.
We have a shortage of primary care physicians in Western New York. The experts tell us you should have about 80 primary care physicians for every 100,000 people, and the number in Western New York is in the mid-50s, and it's declining.
You not only have to wait for an appointment, you don't get much time with the doctor. 75% of general practitioners report spending 20 minutes or less with each patient. Why is their number declining? Well, many physicians, the baby boomers, are retiring, and many younger physicians are choosing specialties that pay more.
The problem is we need GPs. That's the doctor you first go to when you're sick.
The answer is to train more of them, and Senator Schumer wants to do that.
Our bill would create 15,000 slots to train new physicians, half of which would go to general practitioners, so we'd increase the pipeline for GPs.
Similar bills were voted down in Congress last year, but the problem is so severe that he thinks it will pass this time. I asked him about the possibility that nurse practitioners and physicians' assistants might take on some of that practice load.
That can also help alleviate the shortage. For the initial visit to the doctor, particularly in a group practice where there'll always be a doctor on hand, to have nurses do the initial look is not a bad thing.
Now, even if the bill passes and the funding's available right away, it'll be years before the first batch of new primary care physicians is ready to begin practicing. This shortage will be with us for some time.
So what are we going to do until then?
Well, there are some new practice settings, like the patient-centered medical home and like where you have been going for your care, that really can improve access to care. But while everyone else tries to increase the supply, we can all do things to lower the demand.
Right.
Okay? Reduce your own need for medical care. Stop smoking, eat better, exercise more, know your numbers, take your medicine. If all of us did that, we would have more available physicians.
We can all do our own part, and I do love my doctor's office. You're right. Thank you, Dr. Ostro.